Ellen.
Joe.
Good to see you.
Good to see you. I really appreciate your willingness to be a part of this team.
Of course. It's incredibly important to the hospital and our goals for patient care. We need the whole team to be on board in order to reduce our urinary tract infection rate. We all know that UTIs harm patients and prolong hospitalizations. That's bad for the patient and bad for our bottom line, since we don't get paid for patients that acquire infections while they're in the hospital. And the daily necessity checklist you helped develop will be a great resource to the unit.
So I've been thinking about who should be on the team. We need at least one of our nurses who works at the bedside, and we need a physician champion. Physicians sign off on orders to remove urinary catheters, so we're clearly going to need their support.
We are. But don't you need an infection preventionist too?
Absolutely. Infection preventionists bring a lot of knowledge and experience that can help the staff with this effort, and they have access to the hospital databases. But responsibility for this work has to stay at the unit level, because that's where values and attitudes reside, and where catheters are placed, maintained, and removed.
Yes, I agree.
For other team members, I think Audrey Moore should be the nurse on this project. Dr. Susan Crosby is an internist and a champion in this area. Let's bring her in. We're going to need a nursing assistant and a unit clerk too. And I'm thinking of Jerry Evans from Infection Prevention. Would you be able to approach him?
Yes, Jerry Evans is a good choice. I'll give him a call.
Perfect. We've got our team.
We'll see you later.
Dr. Crosby, I know you're on rounds. It's a busy time.
Please, call me Susan.
I was talking with our VP of Clinical Services this morning, and we thought you might be the perfect person for an important project we're working on. Can you let me know when you have a minute?
Sure. We just have a couple more patients to see. I'll look for you afterward.
Okay, thanks.
So, Ellen, what's this project you're talking about?
We're developing an improvement project to reduce catheter-associated urinary tract infection rates on our floor. I think you're familiar with the data. I believe they showed it at your last faculty meeting.
Yes, they told us our unit has one of the highest rates in the hospital.
It's true. We really want to reduce our rates, and we believe you'd be the best person to lead this effort on the physician side.
Thanks. What would I have to do?
Well, it's sometimes really hard to get doctors to sign this form. It allows a nurse to remove a catheter when all the conditions in the care guideline have been met. We're going to need your help in getting docs to sign the form.
I can do that.
Great. Thanks. Allie, I'm really glad you're here. Isn't Audrey working today?
She is. I just saw her go in room 311. I'll page her.
Okay, thanks.
Hey, I got your page. What's up?
Well, I just wanted to tell both of you about a meeting I had this morning with our VP of Clinical Services. He's actually going to be working directly with us to support some of the work we talked about wanting to do. Remember at our staff meeting, Audrey, when we were talking about catheter-associated UTIs, and we had that nursing grand round saying that nurses play such a critical role in preventing these infections?
I went to that grand rounds. Nursing assistants play a big role in that too.
Right. That's why I wanted to meet with both of you. We have an opportunity to put a team together to lead improvement for our whole floor. And our VP of Clinical Services is going to help us. If this goes well, it could help patients all over the hospital.
Morning, everyone. Hey, Joe.
Morning, Joe.
Sorry I'm late.
That's okay. Do you need a minute to get set up?
No.
Okay. All right. Thank you all so much for coming. I'm Ellen Harris, nurse manager on 2 East, and I've been here 10 years. I've talked with each one of you. You know a little bit about what we're doing here. Those of us on the unit know each other, but let's start by going around the table and introducing ourselves to Joe Williams, our VP of Clinical Services, and Jerry Evans, our infection preventionist.
I'm Susan. I'm an internist here, going on about 5 years now.
Thank you. Next.
I'm Audrey Moore, and I'm a staff nurse here on 2 East.
How long have you been here?
3 years.
Thank you. Next.
Hi, my name is Allie.
Allie, would you please tell them what you do?
I'm a nurse assistant.
And you're the lead nurse assistant for the team here, aren't you?
Well, yeah, I am.
Great. And how long have you been here?
For 4 years.
Hi, I'm Jerry Evans. I've been a nurse 15 years, but I started in infection prevention about 4 years ago.
I'm Joe Williams. I think I've met all of you. I'm VP of Clinical Services, and I'll be the senior executive on the team. I've been here for about 2 years, and I'm very excited to be here and working with all of you.
Thanks. You each play a very important role. You know that healthcare-acquired infections are a problem not just at our hospital, but all over the country as well. Our unit has really struggled with catheter-associated UTIs, and we need to reduce our rates. I've spent a lot of time trying to understand how other hospitals have fixed this problem. One is to not place catheters when they're not needed according to guidelines, and the other is to get them out quickly. I spent time working with some members of our team to develop an indwelling urinary catheter daily necessity checklist. Did you all get a copy in the email I sent?
Yeah, sure did.
I think we all understand at any given time, 30% of patients on this floor have indwelling catheters, and guidelines say they should be removed after 72 hours. We're just letting them stay in too long. So here are the steps on the checklist that can help us with that. Susan, as we discussed earlier, sometimes it's really hard to get doctors to sign this form. It allows a nurse to remove a catheter when all the conditions in the care guideline have been met. We need your help to get the doctors on board and sign this form.
Certainly.
Now, take a look at the steps in the protocol. They're based on best practice, which means there's evidence to back them up. I really think that with all of your help, we can do this. Do you all agree?
Yeah, and I think it's the nurse's responsibility to do steps 3, 4, and 5. And the unit clerk can do step 6 by placing the checklist in each patient chart. I'll talk to the nursing staff and the unit clerk about their roles.
Good. Sounds like everyone is okay with this.
I think so.
Thanks for coming, Allie. I just wanted to talk with you for a few minutes. I wondered if you were concerned about anything after that meeting we had.
Not really.
Please, have a seat, Allie. You know, I realized at the end of the meeting that we clarified roles with everybody on the team except you. I'm not sure we really clarified the role of the nurse assistant.
Well, I am a little confused, but I didn't want to sound stupid in front of Susan and Joe.
I can understand how you would feel that way, but your input is essential to our progress on CUSP. We can't do this without everyone, and you will be a terrific voice for all the nursing assistants. It's important that you speak up in front of the physicians and the VP of Clinical Services when you have a point to make or a different perspective.
Thanks, Helen. I can understand that. I'll try to remember that they don't know the same things I know next time. Thank you.
You're welcome. I'd like to start the meeting today by reviewing what we agreed to last time. We shared the indwelling urinary catheter daily necessity checklist. We clarified which team member is responsible for each step on the list. But, you know, I'm not sure we talked about the role of the nursing assistant. Allie, please tell me if you disagree. It seems the nursing assistant is critical for step 5.
Oh, yes. I totally agree. Nursing assistants are critical.
Audrey, do you agree? Does that make sense to you?
Yeah, you know, I actually was confused about that as well, but it's much clearer now. You know, it would be helpful for me if we had this all written down. Do you think we can make a list with the names, roles, and responsibilities?
That's a great idea. I'd be happy to do that.
Ellen, that list will be helpful for me too. I could get confused too about the different roles, to say the staff nurse, infection preventionist, and nursing assistants.
This is a helpful discussion. The only way this is really going to work is if we all speak up and say what's on our minds during the rest of this project.
As we work on the project, I'm sure we're going to run into a few snags. So I'd like to go ahead and schedule our next meeting. I think it's going to take a couple meetings to get the project going.
You know, I'm happy to do that, but sometimes I need to be in another hospital in the system. So, you know, I'll make it when I can.
A conference call is always an option. We don't all have to be in the same place. It would help me too.
That works for me. Thanks, everyone.